ages, regardless of income or disability, to discover ways to remain independent at home and in their communities. And if you are in need of skilled nursing care or residential placements, we're here to help. To learn more, call 311 and ask about New York Connects today. Thank you.
Brooklyn Bridge Park keeps getting better. Hi, I'm Regina Meyer, president of Brooklyn Bridge Park, and we're thrilled to welcome visitors to another exciting season on the Brooklyn waterfront. This summer, come visit our brand new marina, climb the bouldering wall at Main Street in Dumbo, or have a barbecue at the Picnic Peninsula. There is truly something for everyone. Visit brooklynbridgepark.org or call 311 for more information. See you at the park.
Remember, for more information about New York City government services, dial 311 or visit nyc.gov.
Did you know Metro Plus Health Plan, part of NYC Health and Hospitals, is the plan of choice for 500,000 New Yorkers? For nearly a decade, Metro Plus has been the top-rated health plan in customer satisfaction. Metro Plus offers affordable health insurance coverage for New Yorkers of all incomes, including a plan with $0 to $20 monthly deductibles. Find out more at metroplus.org.
This is New York City Comptroller Scott Stringer. It's my job to protect the city's bottom line and ensure that every New Yorker has equal economic opportunity and access to government. My Community Action Center is here to help. If you need assistance from my office, from questions about your pension, a claim against the city, or even concerns about a possible labor law violation, call us at 212-669-3916.
Remember, for more information about New York City government services, dial 311.
Hello, I'm Donna Corrado, Commissioner of the New York City Department for the Aging. Are you age 60 or older? Our 260 senior centers offer social, cultural, educational, and health and wellness workshops, assistance with benefits, nutritious meals, and other life-giving activities. To learn more about DIFTA, please call 311 or visit nyc.gov/aging, and remember to check on your elderly neighbors, especially during extreme weather emergencies.
Comenzando el 1 de enero, hay una mejor manera de llegar al trabajo con la Ley de Beneficios de Transporte de la Ciudad de Nueva York. La mayoría de negocios con 20 empleados o más de tiempo completo en la Ciudad de Nueva York deben ofrecer un programa de ahorros para transporte al trabajo. Tanto los empleados como los empleadores ahorran. Llame al 311 para aprender más sobre esta ley.
Remember, for more information about New York City government services, dial 311 or visit nyc.gov.
I am Manhattan Borough President Gail Brewer. As we age, our brains change, and we have to work a little harder to stay sharp. That's why I'm sponsoring Up With Aging at CUNY's Graduate Center on Sunday, March 20th in cooperation with the Dana Foundation. Join me and other older New Yorkers as we learn how to keep our brains and bodies active and in touch. RSVP at upwithaging.eventbrite.com or by calling 212-669-4039.
Criminal record? You can work with that. I'm Human Rights Commissioner Carmelyn P. Malalas. It's now illegal for most NYC employers to ask about criminal records of job applicants in ads, applications, or in interviews before making a job offer. When employers consider qualifications first, more New Yorkers go to work. That makes businesses strong and powers our economy. To file a complaint or report a violation, and for employers who want free trainings on the law, contact the Commission on Human Rights by calling 311 or visit nyc.gov/humanrights.
Remember, for more information about New York City government services, dial 311.
Did you know that NYC Health and Hospitals serves 1.4 million New Yorkers? Our health system includes hospitals, neighborhood health centers, nursing homes, and post-acute care centers. We are a home care agency and a health plan, Metro Plus. Our talented and diverse workforce is uniquely able to offer high-quality and culturally responsive health care to patients and families. Visit us at nychealthandhospitals.org.
El Departamento de Asuntos del Consumidor tiene un mensaje importante sobre NYC Free Tax Prep. Si usted ganó un ingreso de $62,000 o menos en el 2015, puede calificar para declarar sus impuestos gratis, en persona o en línea.
Well, I just had the opportunity to tour our extraordinary public health lab. This city is blessed with the finest public health department anywhere in the country, and that includes an amazing public health lab that is at the cutting edge of research on the areas that we need to understand to keep our city safe. And the work that has been done by our Department of Health goes back 125 years. This really is the template. This is the exemplar Department of Health anywhere in this country. And this public health lab was, in fact, the first in the country, and again, continues to do great work protecting New Yorkers. And the lab is a crucial part of our effort to deal with the Zika crisis and to be prepared to stop Zika from harming New Yorkers. And a lot of the most important work will happen right here in this building. We are announcing today a 3-year plan. It will cover all 5 boroughs. It's a 3-year, $21 million plan to address the Zika crisis and to ensure that New York City is prepared to keep our people safe. The threat of Zika we take very seriously. This is an emerging situation, and as everyone has seen in recent weeks, new information keeps coming out. That's why we have to have our own capacity to assess the situation and to make sure we have all the latest information to protect people against a threat that, again, is emerging as we speak and evolving as we speak. CDC, we work very closely with the Centers for Disease Control. As you've seen, they have continued to issue additional warnings related to Zika. New information is put out consistently, and we're keeping constantly abreast of those changes so that we can adjust our strategy, and that's part of why we wanted a proactive plan in place so that we could get ahead of this situation. Now, I want to emphasize that we do not see a scenario in this city or in this country where there'll be a widespread outbreak, but that does not for a moment stop us from wanting to address even more limited problems. I want to thank all of my colleagues who are here, and also I'd like to acknowledge the Deputy Commissioner for Disease Control for the Department of Health and Mental Hygiene, Dr. Jay Varma. And I want to thank our host in the tour of the lab, Dr. Wahib Bajwa, the Executive Director of Vector Surveillance and Control for the Department of Health. Now, in this city, we have some of the finest medical and scientific minds anywhere on the globe, and in our Department of Health, we have, again, some of the most experienced and effective public health thinkers and strategists anywhere in this country. In February, we tasked these experts with coming up with a strategy for addressing Zika. We had a roundtable at City Hall where we brought in experts from our private hospitals and from our academic institutions. We put all of our public health apparatus on alert, and we got everyone thinking together about the best way to address this problem. Over the last 2 months, a lot of good work has been done to prepare a strategy to address Zika. The $21 million plan that I talked about is $21 million. It will play out over 3 years, and it has 3 key parts. First, reducing the number of mosquitoes in New York City through targeted and careful prevention efforts all over the city. Second, detecting the presence of the disease swiftly and improving our testing capacity and the reach of our testing capacity to do that. And that will include a doubling of the number of mosquito traps citywide. And third, public information, delivering the information that New Yorkers need to protect themselves and to be aware of this threat and to understand the basic precautions they can take. Now, we have a poster here that'll be part of this. I'm going to walk over to the poster. This will be part of the public education effort, Fight Back NYC, and letting people know about the Zika virus and the basic things that people can do to prevent mosquitoes breeding in their yard, for example, and the importance of using mosquito repellent, the importance of having window screens. Dr. Blasio and Dr. Bassett will talk more about it. You're going to see these kind of public health announcements getting the attention of New Yorkers. Now, part of the additional expenditures we'll be making will be to add 51 new Department of Health workers, and that will include exterminators, inspectors, and lab analysts. Department of Health's been monitoring Zika, as I said, all over the world, working carefully and closely with the Centers for Disease Control, working with the State Department of Health to monitor the situation. We're watching the evolution in other parts of the world, looking for signs that would tell us what we need to do strategically here in New York City. Now, there's some important facts that every New Yorker should know. First of all, Zika is present in 34 Latin American and Caribbean countries and territories. It is present right now. It is a threat to the health of people in those 34 places right now. Second, there have been roughly 358 travel-related cases of Zika with people coming to the United States who were infected elsewhere, 358 for the entire country. Now, for New York City, 40 of those cases have been found in New York City, folks who contracted the disease elsewhere and came here, 40. But we have confirmed once again that no one has been infected locally. So I want to emphasize that. No one has been infected in New York City by the Zika virus. The only people who have it here contracted it elsewhere and brought it here. The specific mosquito, and you'll hear again from the experts who have been studying carefully, the specific mosquito that transmits Zika is not found in New York City, and we have no evidence of that mosquito being present in New York City at this point, and that's another thing we'll be constantly monitoring for. But we do have a similar species, and the concern is to ensure that that species does not end up spreading the disease in any way, and that's why there'll be a focus not only on the constant testing, but the very aggressive preventative measures as well. For most people who contract Zika, it is an uncomfortable disease, but not a particularly harmful disease. And that is true for the vast majority of both children and adults. The real danger with Zika is for pregnant women, for whom there could be a significant risk to their fetus. So we really want to emphasize, if anyone is pregnant and they're concerned they may have contracted Zika, it's absolutely crucial to contact your doctor or go to any medical facility and get a free test to see if you have the presence of Zika. You'll be hearing in a moment from Dr. Blasio and Dr. Bassett, who will give you additional information. Again, they're leading the effort to coordinate with our federal and state colleagues as well, and the private sector experts here in the city. Now, I emphasize we have an extraordinary public health department, and it is tried and tested. This public health department took on the challenge of the West Nile virus and prevailed. This health department took on the challenge of Ebola and prevailed, working very closely with the Health and Hospitals Corporation in that latter situation. So the capacity is here, the knowledge is here, the scientific capacity is here. We're adding a lot more personnel to speed up this effort because we want it to be very robust in the face of this challenge. Quickly in Spanish. Me complace anunciar un plan de 3 años para protegernos del Zika, un terrible virus que puede causar malformaciones en los bebés. Es poco probable que haya un brote de la enfermedad en nuestra ciudad, pero estamos listos para cualquier posibilidad. Si tienen alguna pregunta, especialmente las embarazadas, por favor llamen al 311 o visiten la página web del Departamento de Salud. With that, I'd like to welcome our Deputy Mayor for Health and Human Services, Dr. Herminia Blasio.
Thank you very much, Mayor. And thanks to Dr. Bassett and the entire Public Health Lab for their incredible work protecting New Yorkers from diseases. As the Mayor said, the city has over 2 decades of experience and expertise controlling West Nile virus, and with this plan, we are building on that infrastructure to address Zika. The city has been working diligently with partners at the CDC and the World Health Organization since the bell first rang about this outbreak. This plan prepares the city to respond to all scenarios, from the current situation where we have low number of imported cases to an unexpected uptick in imported cases during the summer months to a potential outbreak in the southern states, and it prepares us for the unlikely but nevertheless possible scenario that we might see local transmission from our own mosquitoes here. Our focus is right now to make sure that we have the infrastructure and all the tools in place to be prepared for all of these scenarios. And we're going to be focusing our efforts on education, as you heard, and on making sure that we work with our healthcare providers and on making sure that we have good mosquito control. And like the mayor said, the mosquito that's causing this outbreak in Latin America is the Aedes aegypti mosquito. We here have a cousin, Aedes albopictus. It is that mosquito that bites you all day long during the summer months. This mosquito hasn't been shown to be an effective carrier of Zika, but Zika has proven to be a rather different virus than some other viruses that are mosquito-borne by these mosquitoes, such as chikungunya and dengue. And it's because of that that we're really leaning forward to be prepared for all of the scenarios. There's some that's known about Zika. As the mayor mentioned, there are new things being learned every day about Zika, and there are still things being unknown. We are taking all of that information, all of the scientific information that emerges, and incorporating it to make sure that our plans adapt to up-to-date science as we protect New Yorkers. We're not taking any chances here, and we're enhancing our surveillance and increasing our mosquito control. And that's really the message, that New Yorkers should know that we're leaning forward, that we are cautiously optimistic, but we are nevertheless prepared. I want to again thank the mayor, Commissioner Bassett, and all of the Department of Health and Mental Health and the Public Health Lab staff. And just to also say a few remarks in Spanish, especially because so many of the people who are traveling to and from Latin America are people who have family and origins there. La ciudad anunció hoy un plan agresivo de 3 años para prevenir la propagación del virus del Zika en la ciudad de Nueva York. El plan fue formulado en consulta con expertos clínicos y de control de mosquitos y se basa en el exitoso programa del Departamento de Salud que ha limitado la propagación del virus del Nilo por más de 15 años. El plan para combatir el Zika se enfoca en 3 áreas críticas: reducción de mosquitos mediante la intensificación y vigilancia a control de mosquitos, aumentar la capacidad de hacer pruebas de laboratorio para detectar la presencia del virus del Zika tanto en personas como en mosquitos, mantener a los neoyorquinos informados sobre cómo prevenir el virus o qué hacer en caso de sospechar que tienen el virus. El plan financiará 51 nuevas posiciones de trabajo entre detectives de enfermedades, inspectores, exterminadores y analistas de laboratorio. Con estos recursos, el Laboratorio de Salud Pública de la ciudad podrá realizar pruebas a los neoyorquinos que sean referidos por los médicos de la ciudad y podrás darles seguimiento a los pacientes que tengan el virus. También les estamos pidiendo a los neoyorquinos que nos ayuden a prevenir el Zika, tomando medidas para evitar picaduras de zancudos, como el uso de mosquiteros, repelente de insectos y vestir ropa claras o camisa de manga larga y pantalón. Y evitar las actividades en el aire libre en horas en que los mosquitos están picando de más. Tanto o más importante de eliminar las criaduras de mosquitos, especialmente las aguas estancadas. Si necesita ayuda para eliminar agua estancada en su vecindario, por favor llame al 311. And with that, I welcome Dr. Bassett. Thank you.
Let me see, where should I put this? Good afternoon, everyone, and thank you to the mayor, my prop holder for the moment. Your prop holder. And also to our deputy mayor. It's really great to be here at the Public Health Lab. Often the Public Health Lab is sort of the back office of many of our disease control efforts. And I'd just like to take a minute to remind you all that this is a very old public health lab. It was established in 1892, a decade before the very venerable state lab called the Wadsworth Center, a lab with which we work closely. It is the lab that saw down the scourges of diphtheria, which we've now consigned to history. It did the testing for anthrax, for Ebola, and for Zika. Public health labs play a very important role, especially when tests aren't commercially available, which is in the case that we have in Zika now. So I want to thank the director of our lab, Jen Rakeman, who's here, and all of her staff for the incredible work that they do in protecting New Yorkers from diseases. I also want to thank Dr. Jay Varma, who leads our Zika response. He's somewhere back. Thank you. And Wahid Bajwa. Dr. Bajwa is our top entomologist. Anything to do with insects, he's your man. So he and all of us at the health department, working with our deputy mayor, have worked hard to develop this plan. As the mayor said, we in the city have over 15 years of experience in handling mosquitoes relevant to West Nile virus prevention, and we're building on that infrastructure to prevent the spread of Zika in New York City. And this plan prepares for all possible scenarios, the one that we have now with a modest number of cases. You've heard the number now stands at 40 today, to the unlikely but still possible worst case scenario where we have local transmission and a local outbreak. Our focus right now is on building up the infrastructure that we already have in place so that we can increase the testing of mosquitoes, which will allow us to determine if our local mosquitoes are carrying the virus, and increasing our mosquito control. This plan also it expands our capacity to test people for Zika. I can now, thank you, Mr. Mayor. We have a new flyer that will help New Yorkers determine if testing is needed, which is mainly a concern for pregnant women and their partners who've traveled to Zika-affected areas. We have a public-facing campaign. It's up already on our subways. As the mayor said, the mosquito causing Zika outbreak in Latin America, Aedes aegypti, has not been found here in New York City. I can put it down here. Has not been found in New York City, but we have a related species, Aedes albopictus, that could carry and transmit the virus. The way this works, it's very important that people understand that this isn't a person-to-person spread, is that the mosquito would bite a New Yorker who'd returned from someplace where they'd acquire Zika infection. That mosquito might then acquire the virus and then bite someone else and give them the virus. So it's to prevent that possibility that we are taking the actions that I'm describing you today. And the real victims of Zika are the unborn babies who are born to women who have Zika infection during pregnancy. There is now a definitive link between Zika infection in pregnant women, fetal death, and a whole host of devastating birth defects. We don't want pregnant women or their families here in New York City to face these risks and its potentially terrible consequences for babies. So that's why this mosquito season, the city will be monitoring and trapping mosquitoes more than ever before, with the aim of reducing the Aedes mosquito population. We're increasing the number of traps around the city, and in areas where we find higher numbers of Aedes mosquitoes, we will target them earlier and more frequently for enhanced mosquito abatement. This strategy will protect the city from a Zika outbreak and from other mosquito-borne infections. So, New Yorkers, we have your back, but we also need your help. As we enter mosquito season, Our message is to help us fight the spread of Zika virus in New York City with this slogan, Fight Back NYC. And there are simple steps to take. You've heard about installing window screens, wearing protective clothing. That just means covering your legs, your arms, using mosquito repellent. And people need to look for effective. We had some examples.
Here they come. Let's do
We'll
Here.
do another show and tell.
You hold up some.
Thank you. We want people to pick mosquito repellent that have CDC recommended products in them. I get to hold some. We want this one has DEET.
These are all
You
approved
can
by the
also,
Department of Health, right?
yes, that's
Okay,
correct.
So these are actual examples of the types of repellents that work and are approved by the New York City Department of Health.
And you want to look for DEET, picaridin, or lemon oil of eucalyptus. Maybe that's the one that says natural. Yes, we're holding them up. We recommend that people even consider taking their mosquito repellent with them if they travel, because you may not be confident that you'll be able to find effective repellents when you get where you're going. We also importantly want to highlight the importance of eliminating standing water. This mosquito, Aedes albopictus, can breed in tiny containers of water, even in a bottle cap. So we need New Yorkers to take care and remove that flower pot that has water in the dish, to remove the bird feeder, and look for all these small household sources of standing water. If you come across a standing water collection that you can't handle yourself, we want to hear about it. Call 311, notify us, and we want to work with all New Yorkers to remove standing water. These are breeding sites for mosquito. By removing standing water, remove the opportunity for this mosquito to breed. Also, our travel warnings remain in effect. We continue to alert women that if you're pregnant or you're planning to become pregnant, that you should delay travel to regions where Zika transmission is ongoing. And if you must travel to one of these areas, we want you to be sure to take precautions to avoid mosquito bites. We want you to talk to your doctor before traveling. And last, although Zika is almost always transmitted through mosquito bites, it also can be transmitted sexually. So we want to remind New Yorkers that condoms are a safe and effective way to protect themselves from sexually transmitted diseases and Zika. If you want to find free condoms, you can call 311 to find out where the free NYC branded condoms would be available to you. And if you want any more information about Zika in our city, you can visit our website, where we work hard to keep it updated, NYC/health. So finally, I want to thank Mayor de Blasio and Deputy Mayor Blasio for their commitment to public health that this response reflects, and for their support in this important plan.
Thank you. Thank you very
And
much,
thank
Doctor.
you for all of your assistance.
Yes. We're always here to hold up things for you. All right. We're going to take questions on this topic, and then we'll take questions on other topics. On this topic of Zika, please.
So, Mayor, the city already does considerable spraying for West Nile, I believe. So just wondering, it seems like what are the new controls going to be? And if you're already doing it, what would the added costs be?
Well, as we said, there's going to be additional monitoring, additional mosquito traps, additional analysis, therefore, because we're going to have a lot more information coming in, and the ability to do additional spraying as needed. I'll let Dr. Bass or Dr. Blasio want to add.
So one of the things that's important to know is we are building on the infrastructure, as you've heard from Commissioner Dr. Bassett, that there is a lot of work done on West Nile virus. West Nile virus is transmitted by a different kind of mosquito than the one we're concerned about for Zika. So you've heard about a lot of the additional traps are really being optimized for this other mosquito. So we're building on the traps that we've got for West Nile virus, which do trap some albopictus, but we're now optimizing a whole new set of traps for albopictus, and that will allow us to direct our efforts not just for the mosquitoes that transmit West Nile virus, but also for the mosquitoes that have potential to transmit Zika.
I think that's it.
Covered it? All right. Yes.
Of the $21 million and the 50 new employees that are being hired, how much of that money and how many of those employees are going to be in place for this season?
Some of that money is for the current fiscal year, which goes through the end of June. So we can get you a breakout, but there's going to be action taken immediately. Obviously, as the warm weather's coming on, we want a lot of this to happen right now. Either one of you want to?
Yeah, we're hiring up now.
Good enough. Yes.
Jump up of testing. I know over the past couple of weeks you've been sending teams out into high-risk neighborhoods where people travel a lot from Latin American and Caribbean countries. Is that working? Because 40 is a lot more than what we were hearing a few weeks ago.
Well, we expect as the summer months to go on that we'll see more and more imported cases in New York City. So that number 40 will go up. And we also know that travel from the areas where Zika virus transmission is ongoing will increase in the months of July and August. So that will also mean there'll be more people coming home to New York who've been in areas. Now, you're talking about our observation that we weren't seeing as many tests ordered from neighborhoods that are immigrant neighborhoods where people may travel back and forth. And we have been going out and trying to make sure that all of their doctors are aware in those neighborhoods that they should recommend testing for people who should get testing. The people who should get testing are all pregnant women returning from neighborhoods, from countries where Zika transmission is ongoing, and anybody who returns who has symptoms, regardless of whether they're a pregnant woman or a man.
Point it out here so everyone sees how it correlates. It is.
So we,
one second,
yes.
So tell them what you got here, just so.
So it just says here, if you are pregnant and spent time in a Zika-affected area while pregnant, we want you to ask for a test. If you're pregnant and while pregnant had condomless vaginal, anal, or oral sex, we're very explicit here, with a man who spent time in a Zika-infected area, that's because we recommend that partners who have traveled use condoms for up to 8 weeks. So your question is whether we're beginning to see an equalization of the requests for testing across the city, and we're tracking that. We're going to continue to work and reach out to people. We've tested in our lab over 1,500 individuals, and in aggregate for the whole city, we've tested over 2,000. The remainder have been tested by the Wadsworth lab.
How many of those that tested positive were pregnant?
We have 6 women identified who were pregnant and tested positive.
Just wondering if the doctor can explain, either doctor, what optimizing the trap for the Zika carrying mosquito, how do you optimize the trap for a Zika?
Well, I may need to call on our entomologists, but there are traps that are specifically designed for Aedes mosquitoes. And we have acquired those traps and are going to be deploying them. They have special bait, they have special construction, and we're going to be placing them in areas where we have concerns about Aedes albopictus. So the type of trap, its baiting, and its placement will all be guided by our understanding of the distribution of albopictus in this. Dr. Bajwa, do you want to? Yeah, you've got to say.
Yeah, there's 60 different sites, where we going to place a special type of traps. It's called BG sentinel traps, and it's only for catching Aedes mosquitoes, So we'll get the mosquitoes, on weekly basis. We bring them to the laboratory, and we will identify them, and then we'll test them for Zika virus. So 60 different locations, will have BG sentinel traps.
Before I take a few more questions on this, I just want to give a chance for Assembly Member Brian Kavanaugh to jump in because he represents this community and all the medical institutions in this community. Just want him to say a few words.
Thank you, Mr. Mayor, and I apologize for being late. I just wanted to say, this is a community that has all of a full range of the world-class healthcare institutions that really are the front lines of dealing with the public health crises we face. We've got Bellevue, which of course was the center of containing the Ebola crisis here, and many of these other healthcare institutions. And we're very proud of that role that this community plays, And of course, we're all very concerned about making sure we have the best possible response for Zika, but we also have every confidence that this city is prepared under the mayor and the health department's leadership and all of the leadership of the health care institutions here. So thank you very much.
Thank you. Yes.
Mr. Mayor, we saw, speaking of Ebola, we saw such an aggressive approach from the state and New Jersey when Ebola started coming to the United States. You spoke out against that approach. Are you fearful or concerned that people would also have that kind of response as the weather gets warmer here to Zika coming to the United States?
I think it's a very different reality for a variety of reasons. I think Dr. Blasio and Dr. Bassett made the point that this is a community here with tremendously strong ties to the Caribbean and Latin America. And people are going to travel. We're talking about in a typical year, I'm sure hundreds of thousands of people and family members traveling back and forth. I think we have to recognize that and respect it. Thank God this is a disease, as you heard, that in most cases does not cause a real harm to people. So we really are trying to focus on the needs of women who are pregnant or might become pregnant. So I think this is different than what we experience in the sort of concerns and some of the fears related to Ebola. So I don't want to predict where things are going. I think right now the job is to make sure we're monitoring very, very closely. We're on top of the situation we have now. We're watching for any new changes and trends, and we're getting a lot of information out. And I think in this case, sober, calm information flowing to people is the best way to deal with it. Yeah.
What was the last time you spoke to Governor Cuomo personally about this issue?
I have not spoken to him about Zika. I'm sure I will be, because I think we're going to be working on this for quite a while.
Sir, you said you anticipate a widespread outbreak of Zika here in New York. Can you explain why that is? Is it because of the species of mosquito?
Yeah, I'll start, and either doctor can join in, or there's so many doctors around me, any of them can join in. Right now, look, at this moment, we have no evidence of the mosquito that actually carries Zika in New York. So that's the number one reason I say it. We have no evidence of the central cause existing here. There is a concern about the mosquito that we have being able to do so, but that is not yet a proven concern. That's why we want to do a lot more testing, a lot more monitoring. So there's a scenario you could see where if either one of those situations changed, that you would be dealing with a bigger challenge. Right now, the central challenge is people who bring it back, and of course, as you heard, they can sexually transmit it. That's a real challenge. But that's not the kind of thing that, at least based on what we know, would lead to a broader outbreak. But either one want to add? Because I've gone to so many medical classes with you, I've learned. Yeah.
Well, I think that the mayor's got it exactly right, that the mosquito that we have here in New York, while it has a potential to be a vector, we haven't seen it behave as a vector in New York City. And nor has it been a vector that has been identified as driving the current outbreak in Latin America and the Caribbean. We also have the past experience with chikungunya and dengue, for which Aedes albopictus can also potentially be a vector, and we've never seen either of those viruses transmitted in this city. So that also gives us a reason to be optimistic. But as the deputy mayor has said, nature can always throw curveballs. This is the first time we've ever identified a vector-borne virus that causes birth defects. So this is an unusual virus, and that's why we're being so aggressive in trying to bring the mosquito population down and carefully monitor it.
Is that what you were alluding to, Dr. Blasio, about the fact that it behaves different than chikungunya and dengue, and as to why it's so important to watch Zika?
Yes, absolutely. So first of all, there's a limited science around Zika because until this large outbreak, it was really considered a very mild disease in humans. So there wasn't a lot of activity around studying it. There have been a couple of outbreaks in the Yap Islands and now in Brazil, where the virus has caught people by surprise, both with the explosiveness of the frequency with which it's transmitted, but also, as Dr. Bassett said, in the clinical manifestations. And as the CDC reported just a week ago, they've now confirmed the suspected link between Zika virus infection during pregnancy and microcephaly, in addition to a number of other neurologic diseases. So the fact that we continue to learn new and surprising things about Zika, both in terms of how it's being transmitted and in terms of the clinical manifestations once people get it, make us less than fully comfortable that we understand everything that there is to be understood about the virus, and make us want to make sure that we've sort of thought out what are the potential scenarios and that we've planned against those scenarios, and that's what you're hearing today.
Is this considered a fast-evolving virus compared to or others?
I think it's less than a fast. I think it has evolved and it's understudied compared with other viruses that we've had more medical concern about in the future. So I think, again, now there's a lot of activity. There's a lot of scientific investigation. I think we'll be learning more and more. And as I said, we have our ears to the ground on this. We are monitoring what's happening not just around the world. We suspect that things will happen earlier in our southern neighbors because they have both albopictus and Aegypti. So we're going to be seeing what's happening around the world as well as here in the continental U.S. and really keeping track on the emerging science and changing our plans accordingly if the science suggests that we need to change our plans.
Mr. Mayor, is any of the $21 million, is that federal money? And how do you feel about Congress? There was a call on Congress to pass some more federal funding to combat Zika. How do you feel about that?
Yeah, well, so on the second point, absolutely. We're going to need federal help. And this is a problem coming to us from other countries, obviously. We are doing all we can locally to address the issue, but we're going to need federal help as this emerges. On the question of the federal funding, that does not include federal funding. That's city funding with some state public health dollars that are automatic matches when the city expends money in this type of area. So it's primarily city funding. Okay, last call on Zika. Let's see if there's anything else. Yes.
Have you learned anything from the Legionnaires outbreak and also the Ebola situation that you are now applying to this situation? Has it changed how you decided to address the situation?
Well, I think we learned from every situation. I think one thing that we need to do is, constant public education. Secondly, the need to be as proactive as possible. That's why we're devoting the money now to the additional testing, the additional analysis by the labs. We're going to, of course, work very closely with our federal and state partners, but this goes in the category of God bless the child that's got his own. Like, we have to protect ourselves. We need to have capacity here to constantly test, including individual New Yorkers. And, much better that we be ahead of the situation. So I think with each crisis we face, we learn new things. I think the public information part is crucial here. Everything you've heard today, this is, thank God, a disease that in general would have very little impact. But we know exactly who needs to be most concerned. Women who are pregnant or may become pregnant. We know the ways to protect them. We've got to spread that word. We've got to make sure everyone has access to that information. Want to add, anyone?
Did I hear correctly, 6 women are pregnant with Zika in the city? How are they doing? Are their kids going to have microcephaly?
We've identified 6 women who were pregnant at the time that they were diagnosed with Zika, and we protect their privacy.
Okay, last call on Zika. Going once, going twice. Other topics.
Mr. Mayor, we looked at the enrollment statistics from the State Board of Elections in advance of primary day and found that the number of active registered Democrats in Kings County actually dropped by 7%, and that 63,000 voters is the largest drop statewide between November of 2015 and April of 2016. I'm wondering if that raises any concerns for you as a voter and in terms of the election administration.
Well, I want to understand how those numbers developed, because I'm surprised by that. Let me begin at the beginning. We need to do a lot to change the way we approach voting in this country, in this state, in this city. There's a lot of reform needed. It has to become much easier to vote. I believe in the whole package of reforms, same-day registration, early voting, vote by mail. I think we have to bring a whole host of reforms, and I'm certainly going to work hard for that in Albany. In terms of our Board of Elections, we have more work to do. We've certainly made progress, but we have more work to do. Now, this number surprises me. I admit that Brooklyn has had a lot of transient population. That is obvious. A lot of people moving in, a lot of people moving out. That might account for some of it. But I'm confused since so many people have moved in that the number would move that much in a negative direction. So I do think at the same time that we've seen a reduction in turnout in recent elections. This is sadly true in a lot of places in the country. It's certainly true in New York. And that, you know, if people don't vote for 4 years, their name is taken off the rolls. So sadly, that could be legitimately part of the problem. But I've asked already today for an analysis of this from the Board of Elections, and I want to come back to you with a fuller answer because it does concern me. Let me take the occasion to say, please, all of you, remind people they have an opportunity to have a very big impact on the course of our nation tomorrow, whoever they vote for. But everyone should come out and vote tomorrow in the primary elections. Yes?
Do you believe that 9/11 family members should be able to sue Saudi Arabia? And do you support a bill that would take away foreign governments' immunity?
I do, absolutely. I think, look, as the place that bore the brunt of 9/11, and I have met so many of the family members who are still in pain, their rights come first. And I have long been dubious of the Saudi Arabian government on many, many levels. And I think we need to reassess our approach to Saudi Arabia in general. But I support Senator Schumer, and as you know, the bill he has put together is bipartisan with Senator Cronin of Texas. We need to protect the rights of these families, and we need to get at the truth, and this is a way to do it. Yeah.
Mayor, one of the issues that's come to light in the course of the investigations that are currently going on in your administration is that information may not have always been flowing to you in the way that it needed to, so that you would be abreast of things before they hit the media. Have you made any changes in your administration to ensure that that won't happen in the future?
It's a huge administration, is the first answer. I have 350,000 employees, over dozens and dozens of agencies, and an $82 billion operating budget. So I do not have the illusion that I'm going to know about everything all the time. I have pushed very hard to the deputy mayors and the agency heads to recognize that we need information on key decisions at City Hall, and there's certain decisions that can only be made at City Hall. And I know you've looked at our decision memo structure, which is something I think actually helps everyone ensure that everyone's been consulted, everyone has been informed. But it's not perfect yet. We're trying to improve that process. I get, you know, a huge number of emails every day. I get lots of communication. I don't get to see all of them, obviously, by definition. So we're trying to perfect the process that when something really matters, it is brought more systematically to my attention. Yeah.
Since Friday, we had two New York City problems that basically clashed: homelessness and slashings. Police just arrested a man who was accused of slashing a man to death inside one of the city's homeless shelters. The same man, they said, slashed a cabbie. And then on Sunday, we had a homeless man that slashed a Times Square Alliance worker. A lot of New Yorkers are on edge thinking that these problems are getting out of control. What is your response to that? And will incidents like this expedite some of the plans that you have spelled out in your 90 days?
The plans are moving forward not because of these tragic individual incidents, but because it's something we have to do systematically. And the bigger point I've made about the NYPD has time and time again focused on an area of strategic concern, put additional resources on it, and turn the tide. We've just seen it over and over again. We had concern in our first year in office around some particular crime activities we saw in public housing. There was a surge of officers and other measures in public housing that brought those numbers down. We had a deep concern last year about an increase in number of shootings. There was a surge of activity. That number went down. In fact, this year, as you know, first 3 months of this year, the lowest number of shootings, the lowest number of murders of any first quarter of any year in New York City history. So now NYPD is turning extraordinary attention to where we're finding stabbings and slashings. Now, we made very clear at the press conference, some of this, sadly, isn't visible to the police. What happens behind closed doors, for example, tragically in a domestic situation. What is visible, most especially, is the activity that happens around clubs, around nightlife locations, both legal and illegal. So you're going to see a lot more NYPD presence in those locations, particularly Friday night and Saturday night hours. On the question of the shelters, we brought the NYPD in now to supervise shelter security and train those who provide the shelter actual security workers. We think that's going to make a real difference in the whole operation. And we're continuing our efforts to determine if someone has a history of violence and a history of mental health problems, how we identify them early and get them either the mental health support they need, or if they are not yet done with the criminal justice system, how we expedite what the criminal justice system is doing with them. So all of those pieces are moving apace. But I say to my fellow New Yorkers, NYPD is very much on the case. They've proven they could continue to drive crime down for over 20 years, and they're going to handle this situation too. Yeah.
If in the course of any of these probes that are going on, any member of your administration is found to have been involved with wrongdoing, is indicted, or is in some way allowed wrongdoing to occur, are you willing to promise New Yorkers that you will fire that person immediately?
I want to say, first of all, I hold myself and my administration to the highest ethical standards. I'm very, very serious about that. The bottom line is we'll look at each situation as it emerges. I don't deal with hypotheticals. I believe anyone who does something wrong should suffer the consequences, as some of our police individual chiefs are at this point. If someone does something wrong, they should suffer the consequences.
On the fundraising investigation, sir, a two-part question, if you don't mind this. One, did you ask Mark Peters to step aside? And two, you said last week that the U.S. Attorney's Office had yet to contact you or have any communication with you. Has that changed?
On the second one, I've said to you also, I'm not going to get into the details day by day. The bottom line here is we hold ourselves to very high ethical standards. We're going to cooperate. We actually reached out, as you know, to the U.S. Attorney's Office to say we're happy to cooperate. That's going to be our stance. On the first question, I did not talk to Mr. Peters, but I'm glad he recused himself. That was the right decision. Thanks, everyone. Thank you.
Thank you. Thank you.